Muy buenos días a todas
Good
los
morning
que
to
nos
you all.
se están sumando, acompañando a
Good day
este
to you all.
webinario
Everyone
que
that
vamos
has
a
joined
abordar la
this webinar.
temática de
We're going to talk
políticas
about national
nacionales en calidad y
policies
seguridad del
regarding
paciente desde la
quality and
OMS.
safety for the patient
Les
at PAHO
saluda
and
Jonás
WHO. I'm
González
Jonas
García,
González Garcia. I am
asesor
an
en calidad de
advisor
sistemas y
in quality
servicios de
systems
salud.
and health
En
services. In
este
this
webinario les
webinar,
saludo desde
I am
Washington,
talking
D.C.
to you from
y
Washington,
tendremos
D.C.,
la
and we will
oportunidad
have the opportunity to
de
share
compartir
experiences
experiencias de
from different
distintos países
countries
de
in
la
the
región
region. And we're
y
going to
vamos a dar unos
take a
breves
couple of
segundos
seconds
para que se sigan
to
sumando
wait for
personas
other
a esta
participants.
actividad. Sin embargo,
I'm
voy a
going to
empezar con dar unas
start with
instrucciones
some
para el uso
instructions
efectivo
regarding the
de la
use of the
plataforma.
platform.
A
I'm going
continuación,
to
voy a proyectar
show
estas
you the instructions.
instrucciones.
In the first place,
En primer
I would like
lugar,
to
hacer referencia a que
tell you
esta
that this
actividad
activity has an
dispone de servicio de
interpretation service.
interpretación.
So
Por lo
please
tanto,
choose
por
the
favor,
language of your
elija
preference.
el idioma de su
You can choose
preferencia.
English, French,
Pueden
Portuguese, or
elegir
Spanish.
inglés, francés,
And we
portugués o
also
español.
have
También tenemos la oportunidad
sign
de
language.
tener el servicio de traducción con lenguaje de signos.
You must click on
Clic
silencing
en
the
silenciar el
original
audio
audio
original,
and then select
seleccionando
the
específicamente el
language
idioma
of your
en que
preference.
desea escuchar
We
la sesión.
also
Por otra parte, también
ask
les
you to
rogamos encarecidamente, si es
introduce
posible, que se
yourself
identifiquen
through
entre los
the
participantes en
participant
la
window.
parte superior de la ventana de Zoom. Y con el mouse seleccionen el ratón,
Please
seleccionen
change your name
su
and
participación
write
y renombren, por favor, indicando el
country that
país
you
en
are
el que nos están
from,
acompañando. Si
your
quieren aportar
institution,
algún dato
and your
más,
name.
si
This is going to
qué
make the
institución o quiénes
interaction
son
easier
ustedes, pues
during the webinar.
nos va a facilitar para la interacción durante el webinario.
We also have
Recuerden
a
que
chat
tenemos
box
también
where you can
área
ask
de chat
questions and make
en donde ustedes
comments.
pueden ir
And this
haciendo
is the channel that
comentarios,
we will be
planteando
using to interact
preguntas
with you.
y que utilizaremos para la interacción con ustedes.
You can also
Puede
choose
también
the
seleccionar la
view that
visualización
you
preferida
prefer at the
en la
top of your
parte
screen.
superior
Our
derecha de la
session is going
pantalla.
to be moderated by Monica
En esta
Padilla. She is an
actividad vamos a
advisor
contar
in
con
health
la
services and
moderación por
systems
parte de la doctora
from
Mónica Padilla,
PAHO
asesora en servicios
and
y sistemas
WHO
de
at
salud
Columbia.
desde la oficina de la Organización
And to
Panamericana
start
de la
with
Salud,
this
oficina
webinar,
regional de
we're
OMS
going
en
to share a
Colombia.
video with you
Y para dar inicio a este webinario, vamos
showing
a
the
compartirles un
general
vídeo desde
impact
la
that
perspectiva general del
care
impacto de la
has
relevancia de la calidad de la atención, qué significa la
that
calidad
is
de la
have
atención
in
en el contexto
healthcare,
de los servicios de salud.
quality
De
services and
nuevo,
healthcare.
muy
Let's start
bienvenidos
with the
a
video,
todas
please.
y todos a esta actividad.
Todos
Everyone
necesitan
needs to
tener
have
acceso a la
access to
atención médica, pero
medical
solo porque un paciente
care,
ha
but
sido
the
atendido
fact that a
no quiere
patient has
decir
received
que
it
su
doesn't mean
condición
that
mejorará. De
his
hecho,
control will
cuando la
get better.
atención no ha sido
If
de
the
la
care has not
calidad
been
suficiente,
good
puede
quality
que
enough,
los
the treatments
tratamientos no
might not
funcionen o
work, or
incluso
it may
podrían
even
causar
they
daño.
even might
En
damage
todo
him.
el mundo, más
More
bien que
deaths
se
are
debe a la poca calidad
related
de la
to
atención
bad
médica
medical
que a la falta de
care than
acceso
to
a
the
los
lack of
servicios
access.
médicos.
15% of the deaths
15%
in
de las muertes en los países de
low-income and
ingresos bajos
middle-income
y
countries
medios
are due to
se
bad
debe a la
quality
poca
in medical
calidad de la
care.
atención
And in
médica.
high-income
Y en los
countries, one
países de
out
altos
of 10
ingresos,
patients
uno de
suffers
cada 10
from
pacientes sufre
damage when they
daños
receive
mientras recibe
hospital care.
atención
So we need to take
hospitalaria.
action to
Es claro que se
guarantee that medical
necesita tomar
services
acción para
provide
garantizar que los servicios
quality
médicos
care that
ofrezcan atención de
improves
calidad que mejore la salud de las
health.
personas.
Attention
La
must be
atención
effective
debe ser
to be
efectiva para que
diagnosed
seas
precisely
diagnosticado de
and
forma
get
precisa y
treatment
recibas
safe
tratamiento
so that the
efectivo.
medical care that you receive
Segura
does
para
not
que
cause
la
damage.
atención médica que
Focused on
recibas no
people
te
so
cause
that the
daño.
decisions that are taken
Enfocada en
regarding
las
your health
personas para
are
que las decisiones que se tomen con
tailored to your
respecto a tu
needs and
salud
so that you are
estén
treated with
hechas a la medida
compassion
de tus
and also
necesidades
timely
y
so that
seas
you
tratado
receive
con
care when you need
compasión
it.
y
It
oportuna
also must
para que
be
recibas
equitable so
atención
that all
cuando la
people receive the
necesites.
medical attention that
También
they
debe
need.
ser equitativa para
It
que
also
todas
must
las
be
personas
integrated so that
reciban
the
la
different
atención
health
médica que
workers and the
necesitan.
different health
integrada
centers
para
work
que los
together
diferentes
to improve
trabajadores de la
care
salud
and
y los
also
centros de
efficient
salud
so that the
trabajen en
available
conjunto
resources
para
are
mejorar
used
la
in a more
atención
efficient manner to
y
improve your health
eficiente,
and
para que
avoid
los
waste.
recursos disponibles sean usados de manera más eficiente para
WHO
mejorar tu
calls the
salud y
countries to
evitar
take
desperdicio.
action regarding
La
medical care
OMS les
and is
hace un
working with
llamado a
them to
los países
develop
para que
plans and
tomen acción con
policies
respecto a la
so
atención
that all
médica y está
patients are
trabajando con ellos para
attended to
desarrollar políticas y
in places
planes
that have
para
facilities that
que
have
todos los
appropriate
pacientes
infrastructure,
sean
and so
atendidos
that
en los
health
entornos que
workers are
permitan
well
una
trained, and so that
infraestructura
they have
adecuada
the time,
y que los
the
trabajadores de la
resources,
salud
so
sean
that
bien
they can
capacitados y se les dé el tiempo,
give good
los
quality
recursos
care.
y el
We
apoyo
are
para que puedan
fostering this
brindar
with
una
governments
atención de
and health
calidad.
institutions so that they work
Estamos
together with
incentivando
people
a
and
los gobiernos
communities
y a las
to find
organizaciones de
new
la
ways
salud
of
para
relating
que
and
trabajen
working
de cerca
together
con las
and
personas y
learn
las
from
comunidades a las
successes
que
and
sirven,
failures.
encontrar
WHO
nuevas
is
formas de
also backing
relacionarse y trabajar
supporting
juntos y
countries to
aprendan de los éxitos
um,
y fracasos.
take action
La
in critical care,
OMS
like, for
también
example,
está
mother
respaldando
care,
a los
child care, the
países para
prevention and
tomar
control
acción
of
temprana
infections,
en aquellas
and
áreas
sanitizing
críticas
water and
como la
hygiene.
salud materna e
We need to take
infantil,
action
la
regarding
prevención y el
quality
control
around
de
the world,
infecciones
but
y el
we need
saneamiento
also
del agua
to
y la higiene.
focus on
Si
fragile
bien se
environments
necesita
that are
tomar acción con
affected by
respecto a la
conflicts,
calidad del
where we
tratamiento,
always need
también
to
tenemos un enfoque
improve medical
particular en
attention,
entornos
medical care.
frágiles y
We are
afectados por
working with partners
conflictos,
to
donde
reach
casi siempre se necesita
sustainable development
competencia y
goals,
mejorar la
which
atención médica.
focus on
Estamos
quality as a
trabajando con
key
socios
element of
para alcanzar
universal
los
health
objetivos del
coverage.
desarrollo sostenible
Our general
y
director
hace
at
énfasis en la
WHO
calidad
says
como
that
un
quality
elemento
is not a
clave de
fact.
la
We need
cobertura
a
sanitaria
vision,
universal.
planification, investment,
Citando
compassion,
al director
meticulous
general de la
execution, and
OMS,
rigorous
la
review
calidad
from
no
the
es un hecho,
national
se
level to
necesita
the
visión,
smallest,
planificación,
more remote
inversión,
clinical level.
compasión, ejecución meticulosa y revisión rigurosa, desde el nivel nacional hasta el nivel clínico más pequeño y más remoto.
Okay,
Bueno,
very
muy
well.
bien. Adelante.
Thank you,
Gracias,
Jonas.
Jonas. Buenos
Good
días a
morning to you all.
todos.
I'm Monica
Mi nombre es
Padilla,
Mónica Padilla. Yo soy
and
la
I'm going
asesora
to
legal que les ahora a
be with you
ustedes desde
today as
Colombia
a
para
moderator.
acompañar este
I'm in
diálogo
Colombia, and
que
this
va a
dialogue is
estar
going to
muy
bring us many good
interesante.
things.
Quisiera primero
First, I'm going to give the
dar la
floor to
palabra al doctor
Ernesto
Ernesto
Vascolo,
Váscolo,
Chief
jefe de
of
las
the
unidades
Primary Healthcare
del área de
Unit
salud
and Healthcare
de
Services,
salud
so that he
para
can address
instruir a
you
todos ustedes y
and give us a
darle el
context.
contexto de esta reunión. Adelante, doctor Ernesto.
Bueno,
Thank you,
gracias
Monica.
Mónica y
For
para
us,
nosotros esto
this is
e- es un
a
déjà
deja
vu
vu
en el
in
mejor
the
de los
best
sentidos, ¿no?
sense.
Este es
This
el
is
cuarto año que, que
this is
incorporamos
something
de
that
alguna forma con un propósito
we
no
want to
solo de
do
difusión, sino
to
de involucrar la
disseminate,
mayor
but also to
participación
involve
posible de
countries,
todos los
their
países, de todas las
experiences, and also
experiencias, incluso de los propios
different
departamentos
parts of
de OPS sobre
regarding
temas que
topics
son
which are
centrales.
central, which are key.
Y en este
In
caso
this
particular,
case,
nuestro
we're
plan
going
tiene
to
que
be
ver con
discussing
la perspectiva de atención primaria
um,
de la salud
primary
desde
health
una
care
perspectiva
with the
territorial.
territorial perspective.
Y esto da
And
lugar a la
this gives
emisión de
place
una
to a series of
serie
webinars that we will
de
be having this
webinars que
year
vamos a tener durante este
that
año, que reitero, de la misma forma que lo hemos hecho en otras
seeks to
oportunidades,
articulate
busca articular no
knowledge production,
solamente
technical
producción de
cooperation,
conocimiento,
and
cooperación
also
técnica, sino
experience exchange
fundamentalmente la
between the
experiencia
countries
por parte de
in
los
certain
países
topics that we
sobre
consider as
ciertas
key.
áreas que
In this
consideramos
particular
centrales.
case, as I
En
was
este
mentioning before,
caso en particular, como
this
mencionaba previamente, esta,
APS territorial
esta
perspective,
perspectiva de APS territorial
primary
busca
healthcare
no
territorial perspective
solo
seeks to
transmitir la
talk
necesidad
about an approach
de un
that
enfoque que
starts at
parta
the
de
population's
las
needs in the
necesidades de salud
territories.
de
It's
la
also about
población en los territorios,
building
sino fundamentalmente
collectively a
eh,
logic
construir
where
en forma colectiva
policy
una
formulation
lógica
processes
donde
have
los
this
procesos de formulación
starting
de
point.
políticas
This
tengan
means that
estructuralidad.
beyond
Esto
the
significa
institutional
que más
architecture
allá
that health
de
systems might
la
have in the
arquitectura
countries, the
institucional que
key
puedan tener los
element
sistemas de salud en los
has to
países,
do with
el elemento
prioritizing
clave
equity
tiene que ver
conditions,
con esta
prioritizing certain
lógica de
territories,
priorizar
identifying
territorialidad priorizar ciertos territorios
as one
e
of the central
identificar
dimensions, what are the
como una de
gaps
las
in terms of
direcciones
access to health
centrales para la
services?
formulación de
And of
políticas, cuáles
course,
son las brechas en
articulating
términos de
points
acceso a
that have to
servicios de
do
salud.
with
Y por
acknowledging
supuesto,
which are the
articularlo en
challenges
lo
in
que
those
tiene que ver
territories.
con el reconocimiento de cuáles son los
And this should be
desafíos en esos
emphasized,
territorios
prioritized,
que debieran
visited
de alguna forma
in the
ser
processes, formulate
enfatizados,
policies. But
priorizados,
at the same time,
explicitados
we
en
should
los procesos de formulación de
acknowledge how the
políticas,
different
pero al
factors
mismo
that
tiempo
make up the health system
reconocer
strengthen the
cómo
capacities of
distintos
our health
factores que
systems in
hacen al
those
sistema de
territories.
salud contribuyen a fortalecer
This
la capacidad
means
de respuesta de los sistemas de
identifying
salud sobre esos
uh,
territorios. Eso
networks,
implica no
first level of
solo
care as a central
identificar a
element,
la
but
organización de
also
los servicios de
the health
salud, a las
needs from the
redes, al primer nivel de
population
atención
and also
como un
its
elemento central,
social conditions
también
as a
las
starting point,
necesidades de
and the
salud por
role
parte de
of
la población y
funding,
sus condiciones
steering, and
sociales
governance in
como
the system
punto de
as
partida
levers
fundamental
that
y el rol del
foster and facilitate
financiamiento, la
that territorial
rectoría, la
approach.
gobernanza de todo el
And
sistema
the
como
series is
palancas que
also going to
impulsen, que
seek the best
faciliten
way
ese
to
abordaje territorial.
build
Y
dialogue
por
with
otro
the other
lado, la
strategic
serie
initiatives
también
from
va a buscar la mejor forma de
and this is
construir el
how we're going
diálogo
to look at
con las
topics
otras
such as
iniciativas estratégicas que tiene la
eliminating
Organización Panamericana de la
diseases,
Salud
the
y de
importance
esa forma
of
soportar
non-transmissible
aspectos
diseases,
como la
chronic
iniciación, la
diseases, and
eliminación
how
de
we guarantee in
enfermedades,
these cases a
la
comprehensive approach
importancia de las enfermedades no transmisibles, la
regarding the
importancia de
population's health
cómo
needs.
garantizamos en estos dos
And
casos un
also
abordaje
digital
integrado
health, which is
de
one of
respuesta
the
a las necesidades de salud de la
innovative
población
elements.
y por supuesto
It's very
también
important in the region to
el
facilitate
tema
that
de salud
response
digital, que
capacity.
es uno de los elementos que
Also,
se
a
han
lot of
desarrollado
actors'
tan
experiences
importante en este
will
momento en nuestra región para
be with us
facilitar
during
esa
this process.
capacidad de
And very
respuesta.
quickly, I
Hay
would like
una
to
innumerables
mention
cantidad de
some
actores,
webinars that are
experiencias que
going to take
nos
place during this year.
acompañarán durante todo este proceso.
So in
Realmente de una
April, we
forma
have
rápida voy a mencionar algunos
quality, national policies,
webinars
and patient
que
safety.
tenemos ya programados
In May,
durante
we're
este
going to
año.
have
Bueno,
the
este en
opportunity to
particular
analyze
de
the
abril, que es el de
financing
políticas
of
nacionales de calidad y
primary
seguridad
health
del
care and
paciente.
integrated healthcare.
En
This is a
mayo
central element. It
vamos a tener la
facilitates
oportunidad de
these
analizar
processes.
experiencias
In
vinculadas
June,
sobre
we're
el
going to talk about
financiamiento de la atención
the
primaria y la atención integrada de salud en elementos
operational
centrales, como le
framework
mencionaba
of
previamente,
the
como un
primary
facilitador
health care in the Americas.
de estos
In July,
procesos.
we will
En el
have
mes de junio vamos a tener una presentación sumamente interesante que es el aterrizaje
a
en las
debate
Américas
on
del marco
opportunities for the
operacional
development
de la
of
atención primaria de la
territorial
salud.
primary
En
health care
julio vamos a
with a
tener
key
también
component,
un
uh,
reconocimiento y
which
un
are the
debate, una
instruments that
discusión
we
sobre las
use
oportunidades
to
para el
talk about
desarrollo
efficiency,
de
quality,
la
and
APS
efficiency and
territorial,
quality. In August, we will
nuevamente
have a
con
meeting
respecto
regarding
sobre
the strengthening
ciertos
of
instrumentos que estamos
capacities of
utilizando
the
para abordar
essential functions in public
acceso,
health.
calidad y eficiencia.
We have done this
En
before, but
agosto
this time
vamos
we
a
will
tener
going
un
to focus on the
encuentro particular
Caribbean countries.
sobre
In September,
el fortalecimiento de las capacidades
we're going
funcionales
to
esenciales en salud
include
pública. Esto lo
emerging
hemos hecho en varias
technologies
oportunidades, pero en
and
este
how these
caso
technologies
va a tener
model
un
the future of
aterrizaje, una
APS.
profundización sobre los
In
países del
October,
Caribe.
we're going
Y en
to talk about
septiembre
how we
vamos
integrate
a
elimination strategy
incorporar el
for
análisis de
transmissible
tecnologías
disease
emergentes,
from
cómo
the
estas
territorial
tecnologías modelan el futuro
primary
de la
healthcare
APS.
approach.
En
November, we
octubre
will do
vamos a
something with
incorporar
chronic
esta
illnesses, and
discusión
in
sobre
December,
cómo
we're
integramos
going to
estrategias de
include
eliminación
these
de enfermedades transmisibles
social
con el
participation
enfoque de
mechanisms,
atención primaria
um,
territorial. En noviembre
including
vamos a
people
hacer lo
and
mismo con las
communities as critical
enfermedades no
players of
transmisibles,
these
con las
processes.
crónicas. Y en diciembre vamos a
And from
incorporar
the
estos
primary healthcare
mecanismos de
point of view.
participación social con
So,
distintos
as you can
de los
see, it's going to be a
determinantes
very
sociales,
intense year in terms of
incorporando a las
activities,
personas y a las
and we're going
comunidades
to
como
be
actores
including the
críticos de
different
estos procesos
primary
del
health
abordaje del
care
APS a nivel
approaches.
territorial.
And finally, I
Vamos
wanted
a tener
to take
como
advantage
verán, un año bastante intenso
of
de
this
actividades
occasion and
donde
all the
vamos a ir
participants that we have here
incorporando las distintas
with us.
dimensiones de
I want to
atención
remind you that we have
primaria
an open
territorial.
call
Y por
for
último,
strategic
quería aprovechar el
consulting,
espacio
advising groups.
y la suerte que
This open
tenemos
call
todos estos participantes en este momento de
is
una gran
open
cantidad de países, de recordarles que tenemos
for
una
expressions of
convocatoria
interest.
abierta para
It
grupos
opened a few days
asesores
ago and it's open
en
until May
México.
3rd, which means that we're going to have
Esta
many weeks
convocatoria
to
abierta
gather, to collect,
está abierta
and to take advantage
para
of
expresiones
this
de interés
opportunity
desde
to have participation of
hace
many
pocos
experts, many
días,
professionals
hasta
in the
el 3 de
region
mayo.
for our
Quiere decir que
department,
vamos a tener
especially
bastantes
and for
semanas para
our primary healthcare
poder
unit and
recolectar
integrated healthcare unit. We have one of
de
the
alguna
advising
forma
groups that
aprovechar
has to
esta
do with
oportunidad de una
primary
grande
care and
participación de
universal
muchos
health.
expertos, de
So
muchos
I ask you,
profesionales en la
please,
región, para nuestro
to
departamento en
participate
especial,
if you want
para
to.
nuestra unidad de atención primaria de la
We're going
salud
to share
y
all of the
de
information,
prestación integrada de servicios de salud.
but please
Tenemos
also
uno de los
share this
grupos
with your
asesores que tiene que ver
network.
con atención primaria
Thank you
y
very
salud
much, Monica.
universal.
I just
Les
wanted to
pido
take
por
advantage of the
favor, no
opportunity.
solo si ustedes quieren participar, si tienen interés, por favor háganlo. Vamos a compartir toda la información sobre requisitos, pero también, por favor, si pueden compartirlo con todas sus redes. Bueno, muchísimas gracias, Mónica. Simplemente era aprovechar este primer momento. Gracias.
Muchas gracias, Ernesto. Agradecemos mucho. Yo
Thank you,
seré
Ernesto.
encargada, colegas, de acompañar el desarrollo del evento
I'm
y
going to
hacerlo un
be in
poco
charge
ahí
of
con
the
los
time.
tiempos.
And
Voy
so
a
I'm
estar
going to
organizándome para
organize you all so that we
participar y
can
aprovechar
benefit
al
from
máximo, pero
this
no quiero dejar de
moment.
decir antes de darle la
And
palabra
now I
a
want to
Jonas, que
give
viene a
the floor
continuación,
to
porque
Jonas.
estamos reunidos aquí
We
porque
have
tenemos
a group
de todos los países de la región.
of
Aquí
several
tengo
countries in the
poquitas
region. I'm
países,
not
no voy a
going to
seguir
say the whole
el
list
tiempo.
because we don't have a lot
Tenemos
of time, but we have a
gran
lot
grupo de
of countries
países de la
here.
región de las
We have
Américas,
regional offices, as you
representación de nuestra
saw.
oficina
We
regional,
also have
cuestiones de
the
aseo y la
WHO,
Organización
and
Mundial de la
we
Salud. Y
are
en
going
fin,
to talk
estamos
about
aquí en este
quality,
diálogo de la
which is the
calidad que
cherry on the
digamos
cake,
es la
which is
cereza del pastel, ¿no? Es
which
decir, aquello
reflects
que refleja
what
todo
is
lo que está
happening,
pasando en las formas en que organizamos
how we're
y
doing in our health services.
trabajamos en nuestros servicios de
And now
salud
I'm
en
going to give the
cada
floor
región.
to John
Así que ahora
Escuzet,
voy
who
a
is
darle la
going to
palabra al doctor Jonas Gonzet, quien
talk about
realizará
the work
una
he does
presentación sobre
as
nuestro sistema
an
de calidad, el
advisor
sistema de
for
servicios de salud de nuestra organización
in
de
Washington.
OPS en Washington y
His
le doy
work
la
regarding
palabra. Jonas, por
quality.
favor, adelante. Estoy atenta.
I'm
Me hace
going to
una
try to
señal
be brief,
cuando
Monica.
necesite
Thank you
hablar.
very much.
Adelante.
Voy a intentar ser breve, Mónica, muchísimas gracias. En cualquier
First
caso,
of all, I would like to
quiero
salute the 25
recordar a
countries that are
25 países que nos están
with us.
acompañando
We have
en
countries from the
esta
region, but
sesión,
we also have
de
countries
la
from
región la
other
mayor parte,
continents,
pero también
Spain,
incluso parte
Myanmar.
hasta desde
So this is a
Myanmar,
great opportunity. Thank you to
y
you
por
all.
supuesto de España. Es perfecto, muchísimas gracias. En cualquier caso, lo que yo quiero compartirles es una perspectiva general de por qué es importante reflexionar en torno a las políticas, planes, estrategias nacionales en calidad y seguridad del paciente.
Anyway,
¿Sí?
what I want to share with you is a
La
general
razón fundamental,
perspective.
si podemos
Why is
cambiar
it
a
important
diapositiva,
to
es
reflect
que
regarding
independientemente de la perspectiva que utilicemos
policies,
para evaluar
plans,
el desempeño de los sistemas y servicios
national
de salud,
strategies in
cualquier
terms
momento, y
of
hacemos referencia
quality
a
and
uno de los
safety
diarios
for the
muy
patient?
relevante, la calidad de la prestación de servicios de
The
salud es
main
central a
reason
esta
is that
evaluación. Y además,
simply
siguiente
from the
diapositiva,
perspective that we use to
va a
assess the
impactar
performance of
directamente
um,
en los
health
resultados
services
con
and
los que consigue el
systems.
sistema y servicio de salud.
The
Es un factor
quality
crítico
of
para
healthcare is
conseguir
central
resultados
in
en
this
salud
assessment.
relevantes y para
Next,
generar
please.
confianza por parte de la población.
I'm going to impact
Por otra parte,
directly the
hay que tener en
results
cuenta la
that
importancia de tener
the
una visión integrada para
system
abordar la
obtains.
calidad.
So
Y esto
this
debe
is a critical
reflejarse
factor to obtain
idealmente en las
relevant
políticas, en las
results and to generate
estrategias o
trust
planes
in the
nacionales que
population.
acompañan
On the other hand, we must take into account the importance of having an integrated vision to tackle quality, and this has to be reflected in policies, in the national strategies and plans that support improvements in health services. It's very important to integrate this multidimensional vision, aspects such as patient with a good. We must have a perspective of integrating these processes. Next, please. I want to tell you that from the PAHO's perspective and from WHO's perspective, we have a very concrete framework. It's pre-pandemic, but it's completely relevant. And actually, the pandemic has made this even more important. We must go ahead in terms of promoting initiatives to provide quality healthcare services. This is very concrete. It has a concrete framework that comes from 2020, that goes from 2020 to 2025. And in September last year, we presented the progress report that you can review. And it looks at the region and the objectives that the states have. And so here we have a series of challenges, and the national policy components in terms of quality and safety is one of the objectives of this plan. But we also have documents that generate synergies, actors community in general, to move forward regarding experiences and also cases that have learned from the pandemic and has strategy and resilient systems, or one that we approved in 2022, which talks about policy and integrated care for improved health outcomes. Next, please. I would also like to mention that in this regional strategy that we have in the Americas, there are three strategic lines of action. One has to do with the classic approach, which is to promote different methodologies that will generate continuous improvements in health services. So this is a little bit more operational. A strategic line of action that is we will talk about today, and this has to do with strengthening the stewardship and governance of health systems to develop a culture of quality. And the third line of action, which has been pretty innovative, which is establishing financing strategies that promote improvement in quality of care and the delivery of comprehensive health services. So the second line has to do with policies at national level. During these years, at the organization, we have been supporting certain of the member states to support national policies, and today we're going to listen to some of these experiences, and we have these documents to support this line of work, but we are also going to share other larger documents, guides, references to support the operational implementation of these kinds of frameworks. And finally, I would like to refer to this. We must have spaces where we have a comprehensive vision, not only what's happening in our country, but what's happening in our environment, to explore alliances, to build upon learned lessons, which is one of the experiences of this webinar. And we have this dashboard of indicators for health systems based on primary healthcare. And so here there's a section on patient quality and quality and patient safety. So, for example, we get to hear what is the level of satisfaction of the people, and this information is analyzed by the countries. Next, please. Or also, if there are programs for clinical practices country, and next, please. And also information on the countries that have current policies, national plans, and strategies related to quality and patient safety. So I urge you to explore these resources that we have at PAHO, and our perspective is to strengthen the implementation, the execution, and facilitating spaces such as this one to create discussions and obtain learned lessons that can strengthen our collective action, our collective progress, and also help the countries individually to promote quality and patient safety. Thank you very much, Monica and colleagues. Now we would like to listen to Dr. Berta Maliki, our colleague from WHO. She comes from Geneva. Thank you very much, Berta. She is going to present the use of the framework for primary health care to reformulate the quality framework. Thank you, Berta. You have the floor.
Thank you very much. And colleagues, good morning, good afternoon. Thank you for this invitation to be part of this webinar today. Great thank you to my colleagues in the regional office for opening the discussion of quality of care, the link to primary health care performance, and advance of this agenda in the region. My name is Berta Maliki, and I lead the units on quality of care in WHO headquarters in Geneva. Quality matters. Among 8.6 million avoidable deaths, 5 million of those avoidable deaths are due to poor quality and not due to lack of utilization or access to services. This is one of the key findings of the Lancet Commission on High Quality Health Systems. For WHO, quality is defined across 7 elements: that of effectiveness, safety, people-centeredness, timeliness, equity, efficiency, and integration. And this is very important because without quality, there is no UHC. We can improve access to services, we can improve availability and utilization, but if those services and care is not of quality for everyone, everywhere, all the time, we will not be able to achieve the UHC goal and the Sustainable Developmental Goals by 2030. The roadmap to the SDGs goes through the primary health care approach. And this is the topic I would like to spend the next few minutes on: how the primary healthcare approach, the primary healthcare framework does build on the quality of care, promotes quality of care, and levers the quality of care. Within the primary healthcare approach, quality of care is one of the critical levers. It does show as one of the operational levers of systems for improving quality of care, but also it shows as a result, as an outcome of a strong and competent primary health care that improves access to utilization with quality. This is important as if we go more in depth in terms of what that framework shows. For quality of care, we can see that it shows across all the different dimensions. It shows across the inputs from structures and physical health workforce, medicines, information systems, digital technologies, and so on. It shows through the lenses of processes, meaning service delivery, as well as outputs on those processes. So it is a process as part of systems for improving quality of care, but also an output of those systems. And those all together are part of service delivery. And everything together influences outcomes. Why is this good and at the same time is problematic? It is good because it shows that quality is well embedded within the primary healthcare framework. It is complicated because it means that quality of care is scattered across all the framework, from the inputs at the beginning to the results as an outcome. In WHO, we have taken a look at the primary healthcare framework, and we have started to annotate it even further to see where does quality sits, what does it mean. And that goes from the beginning, meaning creating the enabling environment for delivering quality, in which the development of national quality policies and strategies is one of the most important elements. But that national quality policy and strategy per se includes all those other elements that may sit in the other building blocks or inputs of health systems. It does include a competent workforce that is able to provide quality care. It includes systems for supporting the health workforce to deliver quality care. It includes the systems and the financial incentives that promote and incentivize delivery of quality care. It includes the engagement of stakeholders, communities, patients, and users who define what quality means in their context, but at the same time who maintain and keep the system accountable for delivering quality as agreed upon. So these kind of social agreements on quality are important. They underpin the delivery, but at the same time, from an approach perspective, they sit at different places of the PHC framework that, if analyzed through the quality of care lenses, it seems quite complex, but also complicated. So how do we move from such a framework into something that is more specific? As an organization, we are working with member states, with countries, with ministries of health, as many of you on the call are today, so representatives of governments and ministries of health, with the implementers, meaning frontline health workers, doctors and nurses, but also program managers and directors or heads of units of primary healthcare centers and hospitals, to start understanding which are those critical elements that make a difference in the development, implementation, and sustainability of quality of care. And that means that it's something that goes beyond only a quality improvement project or process. It goes beyond one single outcome, be that morbidity, mortality, or respectful care and patient satisfaction. And it goes beyond only one transversal outcome in relation, for example, to infection prevention and control, or to satisfaction and, to efficiencies of different, of use of different resources. What you see in the screen is the very first attempt that we have undertaken in the last few weeks in trying to annotate and to identify and annotate the primary healthcare framework for quality of care. So building on the existing health systems framework, on the primary healthcare framework, we're trying to identify what are the critical levers, outputs, and outcomes that are defined by the processes we put in place and by the strategies we put in place, and what is their impact. This first attempt will help us to answer a few questions. First of all, does quality work? For many countries, it's still a question, not only countries, but for many implementers, it's a question. If you put all your effort in quality, would you improve your outcomes? Where should you spend the money? So building those links and these linkages is important. At the same time, it is very important because we'd like to show and to clearly demonstrate that health systems and programs have to work hand on hand. And for that, we'll need to create this enabling environment that allows us to improve quality. Quality requires different data sources and the different entry points for us to understand where we are, as well as to understand where should we put our efforts. By being such a complex intervention and intervention that is based on multiple other interventions and strategies, that implies that we need to bring a bit more clarity, as well as to be able to articulate clearly what has to happen in terms of service delivery and how to support that service delivery. Using the different data sources, we need to come to the most important question, and this is where I would like to end the presentation. We are at this moment, we are trying as an organization to develop what we call the quality of care performance and transition framework. That is basically based on what I already showed on the primary healthcare framework. But within that framework, being able to identify which strategies work best in which conditions. Countries are different among each other, but at the same time, even within the same country, you have different regions and different areas that may have different requirements and needs in terms of quality of care. So how do we adopt the strategies to the context, and that is the transition, and how do we provide evidence-based suggestions and recommendations based on the level of performance. Two guidances are in the process of development, and this is an invitation to all those in the call to be part of this movement in terms of development and implementation. The first is the guidance to self-assess the quality of the national quality policies and strategies. Many countries have developed or already have quality policies and/or strategies. Some of them may be very strong and good. Some may need to be strengthened in order for them to achieve impact. So as WHO, we are in the process of developing this guide. We do have a draft. We'll be very happy to share and to see how best we can learn together in terms of providing the right framework for this type of strategies, as well as driving towards impact. And the second, where we are still short and where we would like to see how best to adapt the primary health care approach and framework, is in guidance for the midterm review and the final evaluation of NQPSs, of the national quality policies and strategies, for us to understand which strategies have worked best, which have the impact, but also to be able to recalibrate and orient these strategies towards the updated or more important gaps, as well as priorities, which we have seen in the last 4 years change very fast, be those from health priorities to social, economic, and so on. So this is a short note for the colleagues in the region, but also in the country, to continue the engagement. It's an area of work that we are all learning together, and we really would like to strengthen the collaboration and learning in order to help each other and to improve the outcomes for all people. Thank you, and over to you.
Muchísimas gracias. Esta ha sido una presentación con muchísimo y muy rico.
Thank you very much. This has been a presentation with a lot of content, and I'm sure that people are asking in the chat if all of this is going to be available, if the presentations are going to be available. And of course, we have them in the website in reference to what we are seeing today. Now, colleagues, beside asking, of course, our peers that are connected and throughout all of the regions, we would like to ask you to look at the chat. We have some interesting links for you, but also for you to be able to accumulate your questions in reference to being able to see the dialogue of this meeting. Now we are going to pass on to the following part, which is a panel in which we will have participants of 4 countries, Bolivia, Costa Rica, Paraguay, and Colombia, trying to look towards the part of the process in reference to what has been the progress or the different times in reference to the presentations that we are seeing from the beginning, now what level or at what time we are in reference to the experiences in our country. So the objective of this part in reference to what we are going to see is that we have these experiences from the countries in the region to be able to identify in what phase we are in, both for the implementation, monitoring, evaluation of strategies, national policies of quality, in order to be able to see throughout this dialogue to find common points that allow us to be able to implement our efforts, and all of us that are here, which is basically 580 people connected that are probably seeing all of these topics every day, and this information is definitely key and strategic for us. To be able to begin, I would like to start presenting as a representative from Bolivia, from the national state of Bolivia. I'm going to present now. Just give me 1 second, please. We had a small change here. Hold on. So we are going to present Dr. Marco Manguia, head of the unit of the Ministry of Health and Sports of Bolivia. With his presentation, without anything further to say, I will give him the floor. You have 7 minutes for a presentation today. So, of course, we are waiting for your content. Thank you very much.
Bueno, muy buenos días, buenas tardes a toda la gentil concurrencia. Bueno, de
Well,
manera
hi.
previa, a nombre de la
Good morning, good
ministra de Salud y
afternoon
Deportes, la licenciada
to
María
the
Germán
people
Castro,
here, and just
la viceministra de Gestión del
on
Sistema de
behalf
Salud,
of
la
the
doctora Marina
Ministry of
Ramírez,
Health and
y a nombre
Sports,
del doctor
licensed
Virgilio Macayo,
Marina
director general
Castro, the
de
Vice
Servicios de Salud
Ministry
del
of
Estado Judicial de
Health
Bolivia,
Management,
agradecer a
and
todos por
upon
la
the name of
invitación a
Jessica
esta
Huacayo,
importante actividad.
Health Service
Y bueno,
Unit from Bolivia.
ya me
We would like
presentó
to thank each and
la
every one of you
doctora
for
y
your
yo, bueno, dar a
invitation to this
conocer
very important
nuestros avances que
activity.
tenemos como
And
país
I
en
was
todo lo
already
que es la
presented
política nacional de
by the
calidad.
doctor and myself, and just to be
Es para
able
nosotros
to see the
importante dar
progress that we're having as a
un
country in
antecedente en
reference to
torno
the
a lo que viene
national
siendo el
policy of
sistema de gestión de
quality.
calidad
For
a
us, it
nivel de
is
lo que es
important to
Bolivia.
be able to give some background in
Para nosotros
reference
era
to what we are
importante ver
finding
el
for the
contexto nacional en
quality
que nosotros
management
nos
system in
íbamos
Bolivia.
desarrollando,
For us, it would
el
be
contexto
very important
internacional
to see the
también, ver
national
cómo países
context that we were going to be
vecinos
developing
avanzaban en
ourselves in,
torno a lo que
the
son las
international
políticas de
context as
calidad.
well, to see how
En ese sentido, nosotros
neighbor
como
countries
país
are
el año
able to have progress
2008
in reference to
generamos,
quality policies. And in that sense,
hemos
we as a
tenido
country in the
avances
year
previos al
2008,
2008 en
we were
torno a lo
able
que
to
son
generate,
estrategias de
well,
calidad.
we have had
Sin embargo,
progress previous to
2008 se marca
2008
un primer
in reference
avance
to
con la
quality
elaboración de lo
strategies.
que es
However, in
el Proyecto
2008,
Nacional
we
de
have a
Calidad en
first
Salud,
progress with the
lo que se conoce a
preparation
nivel nacional
of
como el
the
PRONAX.
National Project of
El
Health
PRONAX
and
inicia
Quality,
como un
what is
sistema
known as the TRONAX. TRONAX is
precursor a todo lo
beginning
que son las
as
estrategias de
a
gestión de calidad
system
y abarca
of
temas de lo
everything
que
that
son
has
los
to do
sistemas de
with
calidad, la acreditación, la
quality
implementación de
management,
los
and it talks
comités de
about the
asesoramiento dentro de lo que
accreditation,
es
quality,
el sistema de salud
the
y
implementation of
la
quality systems in reference to the health
adecuación en torno a
system,
lo que son
and
los primeros
also
avances en torno a la
the
generación de
suitability of the first
e
progress in reference to the
instrumentos que
generation
orienten
of
a implementar
strategies
una
and
cultura de calidad.
instruments that
No
are
obstante, el
allowing us to be
PRONAX
able to implement a
ya
culture of
con el pasar
quality.
del tiempo, con la
However, there's
actualización, con
with
la
the
innovación que
passing of
hubo en
time, with
torno a
the
lo que es
updating, with the
la política
innovation
y
that
las
there was
distintas
in reference
directrices que han
to
ido
the
surgiendo
policy and the
a nivel de
different
instituciones
guidelines that
como
have
en este
appeared
caso lo que es la
at a level of institutions,
OPS-OMS
such as, for
y
example,
otras a
the
nivel
OMS
regional
or the
que
OPS,
han
and others at a regional
delimitado
level,
un camino
which
mucho más
have
profundo, mucho más
delimited
amplio,
a
pero
much
mucho más
deeper and
importante en todo
more
lo que es la
extensive
calificación,
and
a lo que es la calidad
in
de salud.
reference to the
Es
quality and
así que
health.
nosotros como país el año
We as a country in the
2023,
year
2023, perdón,
2023,
ya como país
we
hemos elaborado y hemos puesto en vigencia
been
lo que es
able
la Política
to
Nacional
put
de Calidad en
into
Salud.
currency the
Esta
current
política,
policy,
justamente
national
como muy
policy
bien
of
lo expresaba
health. And this has
el
been
señor
presented
antecedido,
by my colleague before.
abarca
This focuses on
pilares y
pillars and
abarca
it focuses on
estrategias que nos van
strategies
a
that are going
orientar
to
a la
help us
reconversión
have
de este
guidelines
PRONAX,
for
de un
this
proyecto en calidad
project in quality
a una
to a
política de
policy in
calidad
quality which is going to mean a very important progress to be able to improve the attention provided to users, both internal and external users, to be able to guarantee the attention and to generate strategies. I can mention, for example, here that this policy has 4 main pillars, and it has 8 strategies that are going to reinforce these. What are the pillars, the important pillars that are here based or that are forming and having this policy of quality? It's the assessment and updating of the norms and quality. It is understood updating of what we know as PRONACs. The second pillar that we have the security of the patient, which is an important pillar in our policy. And the third pillar also, we have here in reference to health, and the fourth pillar is in reference to the surveillance of the quality and health. And this is in reference to the compliance of these pillars. The first pillar in reference to the standard is basically oriented towards the reinforcing of the recurring, the institutional end of this. Now, as has been mentioned, for us, this is something that is very important. It is very, let's say, frequent, and I'm being told that we don't have the presentation on the screen. Oh, I apologize for that. Marco, I'm sorry, you only have a couple of minutes left, and I think it would just be better if you can have these elements that you are sharing with us. Maybe you can tell us what you have to be able to respond in the particularity of this. From what you were saying, you only have 3 minutes left, so we would like a possibility of summarizing this. Thank you very much.
Muy bien, claro que sí. No sé si estoy con audio, creo que se ha cortado. Ya. Bueno, sí, justamente para nosotros
of course, very good. Okay, hold on. Do I have the audio? Yes. Yes, we can hear you. Okay. For us, the challenge that we've seen with the practice of quality is to be able to look in the project towards a more integrated policy, especially in reference to the information that I've just mentioned with is what has to do with this part. It's about improving the quality of assistance with tools such as the audit in health, and to be able to implement the surveillance of epidemiology health network, the surveillance throughout the implementation of informatics systems that has to do with the challenge in reference to this. And this has to do with the implementation in reference to the territory. Evidently, within what we have the policy of quality, we are considering the environment and the national reality that has to do with our country. This is a standard that has been able to take many references of what the policies of SAFC are, which is an intercultural integrated policy, which are basically seeing here different references and strengths in reference to these different points and focuses and approaches in reference to the attention in health. And considering also what has to do with the intercultural attention. And right now we are in a stage of implementation of this policy. The implementation has to do, one, with its diffusion, the introduction of a management in reference to processes, in reference to being able to see this pillar, the updating of this part in reference to health. We will see what we have here and how we have been able to continue with the information that is here, but the policy also generates the challenge of being able to work in an oriented towards. I apologize, Marco, we are losing your audio. Can you hear us, doctor?
perdimos su audio. No sé si quiere hacer
Se
alguna
perdió el audio.
frase final.
We lost the audio. Just so if you can give us a final phrase before we finish,
Bueno,
please.
sí, bueno, como una frase final, si es que estoy
Okay, well,
conectado
yes,
bien.
as a final phrase, if I have
Como
audio
frase final,
now, as a final phrase,
pucha,
I apologize, we lost connection. Yes, unfortunately, the internet sometimes doesn't work. It's happened to all of us, but I would like to ask you if you can please share your presentation with the group in the email that we sent you so we can just place it and you can actually place some elements. We would ask for the colleagues that are participating if you can please place your questions for us so we have the opportunity to be able to see this. We thank you very much. Unfortunately, we don't have enough time and these are all very important points that you've discussed. We will pass on to the second presentation that we have in this roundtable. Thank you very much. I see that we have here many elements that we can discuss on. We would want to now ask Dr. Jahaira Castro, a professional of public health and responsible of the quality plan in the rendering of services in Costa Rica for her to be able to share the experience in her country. Costa Rica has developed in a participatory process that is currently in its final stage to be able to prepare the National Quality Plan in providing of services for health Costa Rica 2023-2030. Dr. Castro, please let us know about the challenges in this process and how you think about being able to see the diversity in the challenges for their implementation. Go ahead, Dr. Yahaira. Again, only 7 minutes for your presentation. Thank you. Well, thank you very much to you all. Thank you very much for the space that you've given me, and thank you very much for being able to share this experience. In reference to the quality, and thank you very much for having us from Costa Rica. We can see that one of the largest challenges in learning was the implementation that was stated to us throughout the whole process of the strategic plan that incorporates in a reactive manner the methodology for risks and development. This is a methodology that made us and made the country. Basically, it's the entity for the government and it is in charge and reference all of the assessment and follow-up of the strategies for this government. And we're currently in the process of implementing all of the stages of the development of the plan that begin here. We are understanding that what's followed by the country here in reference to throughout the development of all of this, we needed to have a way of learning and to be able to see this in reference to specific plans. And this is to be able to see this part in reference to plan and strategies. And the results in reference to this allows us to be able to identify key areas of strategic actions and also to be able to establish clear responsibilities for the achievement of results and to be able to propose a rendering of service that is effective, having a use of instrument, which is the chain of results, and that chain of results is helping us as a country to be able to establish this part in reference to the different elements obtained for the brainstorming set for the different social actors that were involved throughout this whole participation process. It also helps us to identify different activities, products, and inputs. There's definitely the challenges about seeing the implementation of this methodology would be focused on this end, which means that at the end of the day, these changes that are observed and measured and in reference to the needs and the demands of this part. The lesson learned throughout this whole end is that we were not able to plan something that did not actually produce a change in the policy. The exercise for us was quite wearing out because it had us go back, analyze, and start everything all over again in reference to the questions. However, if the effect in the population, we are able to measure this throughout a specific period, we can also help the articulation of processes and other plans And here we are able to consider this and in reference to this part, given the strategies of digital health, the National Plan of Human Resources, and also this helped us to be able to align with what we already have in the planning process, which is a national health policy and its action plan, just as well as other legal instruments such as a national strategy and what we are able to set in reference to the national development plan for the country to be able to reinforce the quality and the continuity of the services. Many of the challenges that we established are able to see here where we are at now was about being able to see relevant data in reference to the specific realities that we have in Costa Rica. This implied to be able to work with different sources of information, carrying out an analysis in reference to being able to see the needs and characteristics specifically for the health services. It was crucial to be able to work with professionals, service providers for health public and private health as being transformers of regulations and also representatives of patients. So with this, we are able to know that the actions that we were proposing were actually going to be sensitive towards these priorities and needs of each end. Of course, also promoting a focus that is more participatory and equal. Another great challenge that we have here was about seeing that the strategic that we were wanting were to be transversal throughout all of the levels in the system. And here to be able to establish this part in reference to being able to provide follow-up in a closer way in reference to seeing the effect that we were going to have in the quality plan. And we are aware that these parts here were seen and they require strategies and specific focuses to be able to achieve specific challenges. And as another challenge, we were able to be able to see specific things that were relevant and effective in different contexts, considering different factors such as structure and the economy of each country. And finally, we were able to say that a great learning that we've had this partnership to this process to be able to have the success and to be able to see the development of local capacities. And it's about reinforcing the capacities of local actors was definitely fundamental for us. We do know that this idea is able to request different resources, technical support, and to be able to provide supports, professionals, and the people in reference to the communities to be able to propose this participation throughout the execution of all of these initiatives that we have visualized here. And without anything, without leaving that having equality and resources also forms part of this equation. It was also about seeing throughout the planning in reference to being able to see a strategy that are able to help us in reference to these resources, given that what we have verified are able to contribute in one way or another to the redistribution of resources in a way that we have the prioritization of the most needed areas in reference to the justice and social justice and equity. I think that in general, I've been able to summarize this a little bit regarding what were our challenges and of course our experiences that we have had throughout this whole process of preparation. And of course, we would like to thank the WHO that has worked with us throughout this whole planning process that we have almost finished. I believe that right now it's in the final stage completely, and we hope to be able to, in the future, be able to share some initiatives already planned. Thank you very much.
Thank you very much, Dr. Yahaira, for your participation. We published the schedule for webinars in the chat, so I would like to say basically, I'm going to move forward with the next panelists to take advantage of time and draw general conclusions as we move ahead. Now we have the participation Now we're going to have Dr. Natalia Mesa, Director of Quality from the Ministry of Public Health in Paraguay. Paraguay has a national policy for quality for the period 2017-2030, a national strategy to manage strategy in health since 2021. We would like to ask Dr. Mesa to tell us how they have implemented the strategy and what are the main challenges regarding the articulation with other health policies cross sector, such as education, for example, as Costa Rica mentioned, and the other sectors that participate, and how they have tackled the territorial differences. So please, Dr. Natalia, we give you the floor. I am also going to ask, since we have limited time, to respect the times. Thank you very much. Thank you very much, Monica. Good day, good afternoon to all the colleagues that are with us today. It is a pleasure to share the experience that we have in Paraguay regarding the implementation of the national health policy as well as a national strategy to manage quality. This policy started in 2017, as Monica mentioned, and it goes to 2030. So we have been um, using it for 7 years. And we have gone through a pandemic as everyone. And of course, this generated many changes in our countries. Despite this, Paraguay uh, has a firm political commitment to improve uh, healthcare for all inhabitants in our country. In this sense, I would like to share with you our more important advances or progresses that help us improve the quality of care. The first step is to have an organic structure that really fosters strategic access and lines of action. And so, in that sense, since 2019, this quality direction. And we have three main work axes, which is improving quality, enhancing patient safety and security, and humanizing care. In this sense, we have been able to make progress since 2021, and we have a roadmap with those operational guidelines which have become clearer and help us go to the territories and become more operational in terms of what appears in the policy and the strategy. We have also talked about other areas that have to do with the enabling conditions for facilities, professional accreditation, professional training, and health services accreditation. We have also made progress in other areas. One of them is key, which is to how is our policy articulated with other policies? And in that sense, we have been able to incorporate it in the National Strategic Plan, the framework of two administrations in the Ministry of Health. And so for us, this is a very relevant point because it articulates it with the other policies and plans that come from the Ministry of Health. We develop a continuous improvement model, which started in the mother and newborn line of care, has been renewed and is being expanded. And so from that experience, we started thinking about how this strategy could be expanded to other lines of care and to other levels of care, starting with the first level. And this information has to be part of quality system. And so we're trying to integrate this into a national information system, national quality information system. Another line in which we have made progress is patient safety, starting with the international targets for patient safety with guides and protocols for the national health system and not only the public area. And we have worked in a participative manner with all the involved players. We have finally also made progress in everything that has to do with people centered care. So this year we're going to start training human resources in the health services. And I believe that the challenges for the countries and as other colleagues mentioned as well, this has to do with the fact that we need to have a cultural change, a paradigm change that sometimes, and this sometimes there's a lot of resistance to change, incorporating these new visions, these new paradigms. And we have to involve all of players, those who make policies, those who provide services, but also the community, because they have to change how they see us as health providers or health managers in terms of policies. This is a very big challenge for us. And also including the territorial approach, because we always tend to do very centralized things for the highest levels of attention. And so reaching the local level and reaching the different territories with their different particularities is a very important challenge for us who have been implementing our first policy. And it's also a challenge for those who are building their policies, reviewing their policies. We are probably all in the same situation. So that's what I wanted to share with you regarding what we're doing in Paraguay. And thank you once again for this opportunity. Thank you very much, Dr. Natalia Mesa. Thank you for your. It's very difficult indeed to adapt specific areas, as you said. The possibility of maintaining engagement despite the difficulties that we might be having. Now we're going to go to our fourth panelist. We're going to give the floor to Dr. Zuluaga from the Ministry of Health. Sorry, I am mistaken. Now we're going to invite Dr. Rosarina Sara from the Ministry of Health in Colombia, a quality department, so that she can share their experience. Colombia is reforming its health system and approving its national plan to improve the quality of health. We would like to ask Dr. Zuluaga to share with the audience her experience regarding the monitoring and evaluation quality strategies and the process that they're taking place to guarantee quality in a comprehensive plan to improve quality that's aligned with primary care, integrated networks, and also focus on people. So now I give the floor to Dr. Zuluaga so that she can share her experience. Please go ahead, Dr. Zuluaga. Good morning, Dr. Monica, and good morning to everyone that's connected. It's a pleasure to share the Colombian experience and all the challenges in which we are right now. Sorry, Dr. Monica, are you going to show my presentation? Yes. I think it's only 2 slides. Can we please put them on the screen? Okay. So as Dr. Monica was saying, in Colombia right now, we are in a process to reform the health system. This is a great challenge for all of the health systems areas and also especially for the quality area. However, there's something that's very important, which is the follow-up and assessment. I'm going to tell you about how we were doing and after her assessment, where we're headed to after redesigning our system. So in Colombia, for the past 10 years, we have, please next, we have a system based on two concepts, which are very strong. First of all, quality assurance warranting system. And this has three components which are mandatory for all players in the system, enabling services, improving plans for all actors, and the information system for quality, and a component which is voluntary, which is accreditation. This operation tool is accompanied by the national plan to improve quality. We have an operational version from 2016 to 2021. We extended the strategic lines until 2022. This plan worked and works because currently we are redesigning it. I have three structural axes. First of all, the person at the center and the system. And then the quality is a systemic approach. And then third, the transformation of the system through permanent processes for auto evaluation. In this exercise, and very focused on monitoring and follow-up, we created a series of strategies to assess the efficiency, pertinence, and performance of this plan. First of all, we made a systematic follow-up of this plan's performance, which allowed us to identify how these results were in the three main actors in the country, which were contemplated in the system. So, health providers, and we also did a periodic monitoring of this plan's performance, looking at objectives and targets. There's a very important element in the monitoring and follow-up that has to do with the regulatory updates and the strengthening of standards that have to do with the enabling through the information system for quality. Finally, in this plan, we also developed the strengthening of enabling standards with the primary healthcare approach. This was an innovative vision that allowed us to make progress towards the talents that we have today. At the present moment, starting with this monitoring and assessment, we have identified that the strengths from this national quality improvement plan were necessary, but we also had to improve the power of the plan through more robust regulatory measures. Because why? Because we went from a model that was built on financial sustainability towards a model that had to do with the right to health and primary health care as a tracer of the whole operation. And so this creates a series of transformations that we should add together, not only through one plan. In this discussion and in this path, we defined that it was necessary to strengthen quality tools and provide them with more relevance from the regulatory point of view. This is how we defined what we're going to work on three basic operational lines. One has to do with developing quality health policy, which the policy can be public, national, and in which it interacts with the other policies in the country. Right now, we are we're defining the program, and we hope to finish this year, building this policy this year. And we also want to create a plan for quality health, enlarge the time horizon. Before we work on a 5-year basis, and we want to enlarge this time frame to assess results in the long term. And then third, have an integrated quality health system that is the operational branch and that also provides the operational elements. And so we have the three levels for quality in Colombia, a policy that is a strategic component. And regarding the 10 years period, we have the Ministry of Health and all the players, and finally a system, which is the operational component. Out of the three, the line that brings everything together is health access. It is going to conduce the three elements. Primary attention as a tracer and territorialization, and the approach of territorial as in the axis is going to structure us, is going to unite the three regulatory reference. And this takes place in the and so the transformation is going from approach, a market that's regulated from the state based on financial stability towards an approach that's based on rights. This is our big challenge, and this we are moving towards this. And this is the methodological framework. And we use not only transformations of the regulatory area, but also the definitions that allowed us to find the systematic monitoring process that we have been leading for more than 10 years in the country. I think the time's over. I believe that you had one more click, and we give you 1 minute so that you can close. Perfect. What is the policy vision? It's focused on the right to health, and it's focused on primary health care. Our 10-year plan seeks to be a motor for quality and have a more long-term assessment, since 5-year terms didn't allow us to measure the impact that this plan would have and the and we want the system to have a comprehensive vision, because unfortunately it's segmented. Although we have one plan, it's segmented by actors or players, and so our main challenge is the integrality of the system, the comprehensive character of this system, so that we can put all the players together. So this is our challenge. This is our strategic map, and we are very expectant regarding quality in the country. Thank you very much, Dr. Luz Adriana Zuluaga. And now we're going to synthesize. And so we have some specific comments. I would like to use this moment so that So we have listened to the 4 presentations. There are several challenges and several questions have been asked. I'm going to talk about this so that then we can go to listen to our special guest from Spain. So uh, we're going to have 1 minute for each person. And what are the challenges regarding follow up? What are the PAHO and WHO objectives related to these follow up possibilities? How can we our institutions learn have these mechanisms, and so how can we generate systematic quality process in our countries? And also, can we differentiate the quality and safety? Uh, Quality started with the most difficult component, which is hospitals. And today we look at primary healthcare, and this requires clear definition regarding quality. And also, we'd like to know if the community topics and the citizens' vision or views are taken into account in the monitoring tools. And finally, what is the vision that we can constitute with that participation? I would also like to talk about certain challenges that we have. For example, Bolivia talks about how to go from a project to a policy. I think this is very important. And also, how does the policy design takes us to an integrated planification or planning moment. And we're living this in Colombia. We're planning processes, planning regulations, and quality must be integrated. There's also the specificity of the territories, multiculturality, like in Bolivia. And for Andean countries, we need to think about the citizen's perspective, not the user, but the citizen that is using its rights. And it's very important, like in Bolivia, to being aligned to the care model. The SAPSI in Bolivia has specificities in its form of operating, and also what is a dynamic monitoring. How do we look at this monitoring as a progression system as a whole, and not a component that's isolated in terms of quality? So I'm going to request from Nuria Prieto from Spain to comment on what we're listening to. Please go ahead, and for the colleagues that ask me questions, uh, please use the chat if you need to. Please go ahead, Dr. Nuria. Hello, good afternoon from Madrid. Good afternoon and good day for all of those who are on the other side of the planet. Thank you very much for inviting me, and congratulations to all of the countries that are making such progress. And I wish you the best of successes for all the plans that you have. I believe that working in quality is complicated. The first thing that we have to understand is that quality is not something that's tangible. Quality in health is intangible. So we have to be intelligent enough to think that something that's intangible has to translate into results, concrete results. I like very much the video that you showed at the beginning, in which you define the dimensions of quality. Those are that's the base. I believe that in our times, efficiency is one of those pillars that we have to take into account. Also, safety, efficacy, opportunity, so that quality plans are also focused on people. Our experience from here is contrary to what some of you are writing. We started in 2003 with the legislative framework in which the development of quality done in Spain has created a legislative framework. This started in '86 with the National Sanitary Law that has specific articles that tackle quality. And also a law that's a fundamental pillar, which is quality, law, and cohesion for the national health system. Why do I say this? Because in Spain, the national health system, which is a universal system, is public and it's a decentralized system. And it's decentralized in 17 autonomous communities, and they are competent in terms of health services. Army healthcare in Spain has 13,000 health centers and 10,000 medical cabinets. In the public system, we have 149 hospitals, 115,000 beds, and 4 million of hospital entrances during the past year, with 3.5 millions of surgical operations. And so this system is decentralized, and its mission of the ministry to create cohesion and have leadership in quality policies. And this is what Bertha was mentioning at Geneva, how quality has to be adaptable. It has to adapt to the organization and the organizational formulas in each country. And so the main challenge that we have is to understand 17 different ways of understanding health because it's decentralized. And so we understand quality with four pillars. First of all, medicine based on belief. We have a structure, based on evidence. And so we have clinical guides, products based on evidence, and we need to stop doing everything that does not create a value because it produces damage for the patients and it's not cost effective. Another main pillar that we try to put into practice is involving the citizens. And this is why we work on the network for citizens. And also, another pillar is the network to assess sanitary technologies. If you want to say something, Monica, please go ahead. I can't hear you. Your mic is off. You have one more minute. Thank you very much. And so sanitary technologies and enlarging health systems, incorporating something that's says because it's cost effective. Another main tools is to adapt. We must be sure that our centers and services comply with necessary health criteria. And then one other of the fundamental pillars is strategy for patient safety. This is a consensus from autonomous communities, patients, and scientific institutions. This is a life strategy from 2005, and it was updated in 2023. And we look at the global plan for patient safety, which was recently published by WHO. So we have this mirror where we collect the indications we get from other countries. What are the recommendations for the organization, recommendations for the countries, and recommendations for sanitary centers? That's the exercise that we're doing to have a new strategy, taking this world plan as an option. The public says that you need to continue, but it's important to have access to the documents. Jonas is there and the team as well. So maybe we could do a small video with you so that we can offer our public to know more about this. So maybe we could have a more detailed material so that we can put it, send it to everyone. Yeah, they say good idea, video. Thank you very much. We have a lot of expectations regarding these elements. this community is here. It's very stable. We have still 560 people, and there's a lot of interest for this. So we're going to work on this on their page so they have access to these elements. Thank you so much, Nuria. And now we're going to have Jonas Gonzet. Jonas, you put me in charge of time. I give you 1 minute to comment also on the questions that we have in the chat, and so that we can close the session. Please go ahead, Jonas.
Muchas gracias, Mónica. Muy pequeño el comentario y además relacionado con queríamos originar esto, queríamos originar la necesidad de
We wanted to see this need of looking for more in reference to how we are able to see this part in reference to the perspective of quality. And I think that we've been seeing the need of the point of governance of having these policies in the situation of countries in reference to what is seen here, which are the different statuses. We really haven't had a space where we have been able to share experiences. We haven't had a space where we can look with a vision that we are able to get to a certain consensus. Of course, doesn't have to be the same one to analyze this impact. So I think to be able to see these kind of discussions is the greatest added value, and without a doubt, in reference to being able to have sharing more, it's a very good signal. So we still have this challenge on the table. I would like to highlight how we have evolved throughout the years from having a perspective very much focused on initiatives that were about improving the attention in health institution and or fragmented and in the best cases in networks. And now there is a general consensus in reference to the system, in reference to this alignment in reference to being able to see this part here as has been shared. So I believe, and this has been seen in reference to the reality in Bolivia, it showed the interculturality in reference to the social part of the country. And to be able to see this, because I think it's an agenda, and to be able to have more visibility in reference to the humanity part on present in the policy of Paraguay, the policy of Paraguay, to be able to see this technical end. I know I'm extending myself to be able to see this. Thank you very much. We are going to right now, we have 1 minute for each panelist. We cannot lose the presentation or the announcement. We have a very important event, which is the 6th Regional Summit of Ministry of Health, and we are later going to pass on to the closing of Dr. Vasculo. So right now I'm going to begin 1 minute per person, colleague from Bolivia. Let's begin with you. Thank you. Your final message, just what tips are giving you to be able in reference to this quality ends. Okay, we have the colleague over Bolivia.
Bueno, muchas gracias en el tiempo establecido.
Thank you very much. Given the time that has been established, we as Bolivia have had quite good progress in reference to interculturality, as it has been mentioned in the SAPSI policy, and also with the implementation of the National Policy of Quality with the pillars and the approach, in reference to interculturality, with the approach that we have of a health with quality and integrated and for services, also other important ends to be able to give continuity in a focus and an approach in reference to what is said here for the patient and focusing on the attention not only of the health as a person community. It is important, it's greatest progress that we're having. However, the work is still has to continue, and we as a country have all of the availability to be able to achieve and continue with this, with the implementation of a policy, with everything that is applied with this. And therefore, we've considered within this part of quality the participation of society in a participation, an active participation, with we have the generation here of a culture of quality and social participation. Thank you very much. Passing on to Yajaira, please, from Costa Rica, your final message. Thank you. Well, without a doubt, the quality and the security of patients is fundamental in any system, any health system. And especially it is relevant in the case of Costa Rica, where we're always trying to guarantee this part of the population through a public health system of high quality and accessibility. The importance of quality and the security of the patient in the system for us has to do with different aspects. The first one of them is that we are able to guarantee the population with an effective and safe, and this implies that the population is able to receive the treatment and are able to minimize certain mistakes that are there always present, complications and events on that end. Also, it's about increasing the trust on the population, given that this is a health system that prioritizes the quality and security, generates trust is very important. In addition, their participation in all of these processes. Again, being able to improve the results because here seeing the quality and the parts that are being led to these better results of health at an individual and population level. It is important to being able to establish it that it's always going to contribute to the proactive manner in reference to this end and the effective part of conditions and also the reduction of mortality that we are seeing here. And another one that we believe another reason for which we need for the health system to be more efficient, right? It's by preventing the complications, for example, and the events. We are going to reduce the need of additional resources to be able to absolve and to be able to see this end, which is going to contribute this part in reference to the available resources and the availability of the system. That is something that we cannot forget. As a summary, it's about a win-win situation. It's a win-win situation. Yes, so we trust in the population. It's a marvelous, very important. And we're passing on to Dr. Mesa from Paraguay, your final message. Many things to say. We can start rescuing all of these keywords, please. Well, I believe that this is a great challenge to be able to place this in the public agenda. Quality and security of the patient to place them continuously in the public agenda is a very large challenge where I ask everyone to actually persist, never desist, because it is something complicated, it's complex, something that has many challenges, right? To try to always focus on the fact that we have people in the correct and their needs in all of the policies, and especially in the focus of quality. And I wanted to mention the 3 points that we wanted to make emphasis on was that we cannot remember in reference to this part, to what we are measuring and these and in reference to these actions and also the impacts both of the policy and the strategies and of the other challenges so that we are not only able to improve the quality but be able to see how we set our policies and strategies that sometimes are very beautiful documents, have a very large effort, and then at the time of making everything what needs to be set in reference to what is local, we are able to see sometimes the general frustration. So it's about sharing the policy and the strategy and also the actions. Marvelous. That is a very good comment. Going back to the final message, and now we have Dr. Mauro Simi, please. Luz Adriana, go ahead. It's difficult to say it in 1 minute, but I would like to highlight 2 points here. The first one, and I share here in reference to what we're able to see here, in reference to being able to set here to what we have in the health system to be able to see in here this part as focus and centers. And this is very difficult because this meets a series of paradigms in reference to being able to see a public quality. In reference to this part, and in reference to being able to see this part, in reference to the actors, to the parts of the service, to be able to see in reference to this end, throughout this part, in reference to this end of what is done through different orders or the constitutional court, but we also have here in reference to being able to monitor the part of the user as an element that is key of an evaluation and follow-up of the system. And finally, just to also being able to take to within this part of the settings, we have the dynamic monitoring. In the proposal that we have set, we have also a proposal of being able to analyze the quality and health, which is about being able to establish quantity with integration of sources that will allow us to be able to see a lineal end of the indicators in particular, but also the correlation of indicators in reference to the integration, as with these models of artificial intelligence, for us to be able to model this in a better way in reference to the results and the perspectives of the quality of health. And thank you very much. Very important point. And also how we give users in reference to being able to establish how people are able to place this here in Colombia. We have different experiences, and it's already being placed here in reference to how we are able to educate on quality things that sometimes are not passed in reference to this end on this part. Thank you very much. Many things we are now going to pass on to Dr. Maurosini from the organizing committee of the event from the Ministry of Health of Chile, if he can tell us a little bit about this global summit that we have in Santiago de Chile, the sixth summit. And we will ask if he can please comment. Just 1 minute, just very, very quickly. We need to finish. Yes, not a problem. Thank you very much to the organization. Thank you very much to the OMS for allowing me to be able to establish this. Chile is the first region in the country that has the that is going to host the following World Summit of Security and Patients. This is an activity that is being developed in five different versions, five previous versions, a majority of them in Europe. And as we were saying, the relevance is the first time here. And this is basically more oriented in reference to being able to know about regional experiences in reference to seeing how we implement strategies related to health security, always having as a framework the action of the global and of the WHO, and also seeing different part of what we are here. We try to see this and that were interregional aspects. In the chat, I've placed a link of this official website. The description, the inscriptions are completely free, but this is going to be seen by streaming both in English and Spanish both days so that you can connect. Thank you. Thank you very much. Well, on this space that we are finding is wonderful, we are now going to pass on to the closing words to our boss with all of this richness that we've had throughout this time this morning. Go ahead, just 1 minute again. I will try to be very brief as well. So my colleagues, just 1 minute. Thank you very much. Congratulations, Monica, for your performance as a moderator. It's been incredible. Incredible how I have enjoyed the dynamic of all of this work. First of all, I think it was a an impressive day here with people from the WHO and Pajo also in reference to being able to see primary and health and also a perspective and systems. I believe it's been wonderful in reference to this presentations and how in a certain way we've been expressing this in reference to these different countries, in reference to seeing this parts of Bolivia, Paraguay, Costa Rica, Colombia, and even in the case of Spain. Here are the specificities, the emphasis that have been placed and how this has been shared in reference to the experiences on that end. I just want to highlight on the fact that also a level of participation has been very large, over 600 people participating in this dialogue, but over 28 countries and 25 countries of the region. I would say almost all of the countries of our region were participating today in this event. Honestly, I would just like to congratulate each and every one of you in the team, not only the participants that were behind the scene organizing this. If there was a way of beginning this series of primary assistances with health in the perspective of territory, it was this way of doing it. So nothing else. Thank you very much, Monica. Thank you very much. And it was a pleasure to have present and participating in this event. Thank you. Thank you very much to all of you colleagues. We have many questions, of course, and there's going to make a synthesis of this encounter. We will be having a web page. We'll try to incorporate all of the presentations that are going to be available briefly. So thank you very much for your time. And to the colleagues that are in the part of the organization, thank you very much to all of you. Unless you have any other comments, we are ready to finish because we are against time. And just I wanted to close and thank you very much for inviting me to be a moderator for this group. Thank you very much. Goodbye. Thank you, colleagues. Thank you.